Hi everyone, my name is Adebisi Ajayi. I say past patient of Evercare. In 2016, I had a scare. I was pregnant at that time, and I had a scare and was rushed to the hospital. On getting to the hospital, we were told I had ulcer. So we started treating for ulcer. So I was pregnant. So every time I felt a pain, the same way, I treat for ulcer. So sometime last year, 2023, I had the same pain. Now note that the pain always came and went, but when I treat for ulcer, it goes. So in 2023, I had that pain sometime in May, and it was unbearable. So I went to a hospital close to me, Modern Child, Abdominal, where the doctor looked at me and said, "This pain is more than ulcer." So she said to do an abdominal scan. I found out I had about 7 stones. We asked around and asked, okay, what's the best hospital to go to? And we were referred to Evercare to see the General Surgeon, who was Dr. Arinzechukwu. I came back a few days after to see Dr. Arinzechukwu, who confirmed to me that I had 7 stones in my gallbladder.
I met Mrs. Adebisi Ajayi sometime last year during one of my clinics, and she's a very interesting lady, very jovial and amiable, but has been suffering from an undiagnosed abdominal pain for the past 7 years. She's been through different hospitals and different doctors and healthcare workers who kept treating her for presumed peptic ulcer disease. But when I examined her, I realized that her symptoms were not very straightforward, so to speak. We're not very specific. So I encouraged her to undergo some further evaluation, one of which was to have an urgent ultrasound scan of the abdomen as initial evaluation, and this confirmed that she had multiple gallstones. We also did an upper gastrointestinal endoscopy, which excluded peptic ulcer disease. So I counseled her that, look, we've been having this problem for more than 7 years now, and from the look of things, it looks like this has been chronic for a while, and the risk of further complications are high. And I encouraged her to come and be evaluated further for possibility of having a laparoscopic cholecystectomy.
Now he told me what to do. He said we will have to take them out, and I disappeared.
This she answered in the affirmative, but it was striking to know that I never saw her again until early this year.
So I disappeared for about a few months, even though I didn't have the symptoms anymore until this year in January, when the pain started again. And I think I just made up my mind that it was time to go out. So I came back to him in March.
Laparoscopic cholecystectomy is a kind of surgery where we use tiny incisions and specialized equipment called the laparoscope to perform surgeries that hitherto would have required very large incisions or cuts on the tongue. And the call to fame of laparoscopic surgery is that the patient comes out with barely no scar and get back to their feet on the same day and may even be able to go home the next day. And that's exactly what Mrs. Ajayi had. So she came in and surgery went smoothly, and she was discharged on the second post-operative day. It was a difficult surgery because she's been having chronic cholecystitis, which is inflammation of the gallbladder, for a very long time, and with a lot of adhesions, which is joining of tissues to themselves and involving major structures such as the liver, the duodenum, the colon, as well as the major bile duct. But in the whole, we were quite steadfast and meticulous, and were able to get everything sorted out without having to convert to open procedure.
I got in on Wednesday, and on Saturday I was discharged. And here I am, 2 days after. Today's Tuesday. You're looking for somewhere to do something, anything. I believe strongly that they have the best doctors. They have, the best hands, and they'll give you the best. Thank you very much.